Welcome back to the Senior Strength Show, where we address the real concerns about aging with honesty, clarity, and practical solutions. I'm Authur, your host. But today, we're not talking about nutrition. We're not talking about exercise. We're talking about something deeper. Something that keeps millions of people awake at night, but few are willing to say out loud. How do you grow old, really old, without children to care for you? If you're in your 30s, 40s, or 50s and quietly wondering who will be there for you in your 80s or 90s, you're not alone. Nearly 1 in 5 American adults is childless, by choice or by circumstance. And that number is growing. But here's what the headlines don't tell you. Being childless might actually offer some advantages when it comes to aging, advantages that parents often don't have. Today, I'm joined by a geriatrician and aging specialist who has spent over 25 years studying what it really takes to age well. She's also childless by choice, and at 68 years old, she's living proof that you can age with strength, dignity, and purpose, even without family caregivers. Doctor, welcome to the Senior Strength Show.
Thank you for addressing this crucial topic. The fear of aging alone is very real, especially in a society that assumes family will always be there. But I'm here to share practical strategies that not only ensure excellent care in your later years, but often lead to even better outcomes than the traditional family-dependent aging model.
Let's be honest. Most people grow up thinking that having kids is the ultimate safety net. Someone to look after you, someone who'll be there when your health declines or your independence fades. But what if that belief is actually holding us back from preparing better?
That's exactly where we need to start, because the idea that having children guarantees care in old age, it's more comforting than it is accurate. In truth, nearly 40% of adult children live more than 2 hours away from their aging parents. And even when they live closer, many are juggling their own careers, kids, finances, even health issues of their own.
I've seen it firsthand. Seniors in nursing homes whose children only visit on holidays, or sometimes not at all. And on the other hand, I've met childless seniors who built deep, intentional support systems. People who aren't related by blood, but who show up consistently, compassionately, because they truly want to be there. The difference isn't about biology, it's about intentionality. Successful aging without children requires one thing above all else, not leaving your future to chance. You plan it, you build it, you lead it.
That's powerful. So what actual advantages, if any, do childless people have when it comes to aging well?
Several, and they're more significant than most people realize. First, financial flexibility. Without the enormous cost of raising children, many childless adults accumulate more savings over time. That translates into more choices, better housing, private caregiving, quality health care, and the ability to adapt quickly as needs change. Second, lifestyle autonomy. You're free to decide where to live, when to move, who to live near, and what kind of support to design without needing to factor in a child's job location, family obligations, or emotional expectations. And third, relational clarity. The people in your life are there by mutual choice, not inherited obligation. That often creates stronger, more respectful, more enduring support networks. Care that is chosen tends to be more consistent and wholehearted.
Let's talk about the financial aspects of aging without family support. What do people need to prepare for, and how early should that planning begin?
Financial planning is absolutely essential, and the earlier, the better. Ideally, it should start in your 30s. Childless individuals in particular should aim to save about 25 to 30% more for retirement than those with children. But here's the good news. You're also likely saving by not having to pay for things like daycare, college tuition, or supporting adult children. One of the smartest moves you can make is to get long-term care insurance while you're still healthy, typically in your 40s. That's when premiums are more affordable and coverage is easier to qualify for. A good policy can cover everything from in-home caregiving to assisted living and skilled nursing care. Without that, these services can drain your life savings faster than most people realize.
In addition to retirement accounts, I always recommend creating what I call a care fund. This is a separate pool of money specifically set aside for future care needs, things like home safety modifications, hiring professional caregivers, transportation to medical appointments, or covering short-term rehab costs. It gives you peace of mind knowing that money is there for your future self.
And how does housing factor into all of this? I imagine it's a major decision when you don't have family nearby.
Absolutely. Housing strategy is critical. Your living environment becomes your care environment as you age, so it's worth thinking about early. Some people choose to age in place, making necessary home modifications, grab bars, stair lifts, walk-in tubs. Others explore what we call NORCs, naturally occurring retirement communities, where neighbors grow older together and support one another organically. Another option is moving into a CCRC, a continuing care retirement community. That's what I personally chose at age 60. I still live independently now, but I know that if my needs change, I have access to assisted living or skilled nursing within the same campus. It's like buying insurance, not just for care, but for peace of mind around your living situation. And increasingly, we're seeing more people, especially childless adults, form or join co-housing communities or intentional neighborhoods. These are designed with aging in mind, where residents look out for one another, share resources, and create a strong, reliable support network. They're not just sustainable, they're deeply fulfilling.
Financial prep is one thing, but when it comes to aging well without kids, the real game changer is human connection. And that brings us to one of the most powerful strategies, building your own chosen family.
The most important strategy for childless seniors is creating what I call a chosen family, a network of people who will support you through aging. This isn't just about friendships. It's about intentionally building relationships with people at different life stages. Start by cultivating relationships with people 10, 15 years younger than you who might be willing to take on advocacy roles as you age. These could be nieces, nephews, younger friends, or mentees. Build relationships with your neighbors, the people who see you daily and would notice if something was wrong. Strong neighborhood connections are often more valuable than distant family relationships.
How do you formalize these relationships?
Consider legal arrangements like creating a chosen family care plan where friends agree to specific roles. Some people draft formal agreements about decision-making, emergency contacts, and care preferences. You can also hire professional advocates, geriatric care managers, who oversee your care, coordinate services, and ensure your wishes are followed. Think of them as professional family members. I have a network that includes a younger friend who's my healthcare proxy, neighbors who check on me regularly, a geriatric care manager I've already interviewed and selected, and a lawyer specializing in elder issues.
How do childless people ensure they receive proper medical care and advocacy, especially when there's no adult child or close family member in the picture?
It all comes down to proactive planning. You can't afford to be passive and just hope for the best. You have to lead your care with intention. First, build strong relationships with healthcare providers who truly understand your situation. Choose doctors who communicate clearly, who take the time to explain your options, and who are willing to treat you as a whole person, not just a set of symptoms. Next, prepare detailed advance directives, not just a standard living will, but documents that reflect your personal values, how you define quality of life, what kind of interventions you do or don't want, where you prefer to receive care. Be as specific as possible. These documents speak for you when you can't speak for yourself. And for bigger medical events like surgeries or serious diagnoses, consider hiring a professional patient advocate. These are trained experts who help you navigate complex decisions, communicate with your care team, and make sure your voice is heard. In many cases, they can be the difference between feeling overwhelmed and feeling in control.
That's incredibly helpful. But what about everyday health management? The small things that keep people safe and independent for longer.
Well, technology has become a powerful ally here. Devices like automated pill dispensers, blood pressure monitors, and medical alert systems like Life Alert or fall detection on an Apple Watch are lifesavers, especially for those living alone. They not only provide safety, but peace of mind. Also, don't wait until you need help to find it. Start building relationships with local home healthcare agencies now. Interview them. Learn what services they offer. Understand how they scale as your needs change, whether it's occasional check-ins or full-time support. I also recommend creating what I call your personal health team. This might include your primary care doctor, a geriatrician, a pharmacist who knows your medication history, and any specialists you regularly see. When these people know you and each other, it becomes much easier to manage your health smoothly, especially during emergencies.
Okay, so we've covered finances, housing, even legal planning. But let's not forget the one thing that keeps life meaningful at any age: connection. How do childless seniors stay socially engaged and emotionally supported?
Social isolation is one of the biggest risks for aging seniors, especially those without family nearby. The solution is to be intentional about building and maintaining community connections throughout your life. Join organizations, volunteer for causes you care about, participate in religious or spiritual communities if that's meaningful to you. The key is building relationships before you need them. Consider intergenerational friendships. Mentor younger people in your profession or interests. These relationships often evolve into mutual support systems where you offer wisdom and experience while they provide energy and assistance.
What about when mobility or health issues limit social participation?
Plan for this transition. Investigate senior centers, meal delivery programs, virtual community options, and in-home social services. Many communities have programs specifically designed to prevent senior isolation. Technology can maintain connections when physical presence becomes difficult. Learn to use video calling, social media, and online communities. These skills become crucial for maintaining relationships as you age. I've seen childless seniors who are more socially connected than those with children because they've been intentional about building diverse, strong community ties throughout their lives.
What legal preparations are essential for childless people planning for aging?
Legal preparation is absolutely critical. Start with a comprehensive estate plan that includes wills, trusts, power of attorney documents, and healthcare directives. Choose your decision makers carefully. Your healthcare power of attorney and financial power of attorney should be people who understand your values and will advocate for your wishes, not necessarily your closest relatives. Consider setting up what's called a standby guardianship, a legal arrangement where someone you trust can quickly become your guardian if you become incapacitated, preventing the state from appointing someone you wouldn't choose.
What about end-of-life planning?
Be specific about your end-of-life wishes. Include details about funeral or memorial preferences, how you want your possessions distributed, and any final messages or instructions. Consider working with an elder law attorney who specializes in these issues for childless individuals. They understand the unique challenges and can help create comprehensive plans. I update my legal documents every few years as my circumstances and relationships change. This isn't a set it and forget it process.
Okay, so we've talked about money, medical care, and building your tribe. But let's be real. None of that works if you're living in a place that doesn't support your needs. So, doctor, can we talk about where we're all going to live while we grow fabulously older without kids?
Housing strategy is crucial for successful childless aging. You have more flexibility than parents who often feel tied to locations near children. So use that advantage. Consider aging-friendly locations, communities with good public transportation, walkable neighborhoods, quality healthcare facilities, and strong senior services. Investigate different living models, continuing care retirement communities, active adult communities, co-housing projects, or even international retirement in countries with excellent affordable healthcare and senior services.
What about staying in your current home?
If you choose to age in place, start modifications early. Install grab bars, improve lighting, consider stair lifts or first-floor living arrangements. Make your home safe and accessible before you need these features. Build relationships with local service providers, house cleaners, yard services, handy people, grocery delivery services. Having these support systems in place makes aging in place much more feasible. I know many successful childless seniors who've created aging-in-place teams of professional service providers who help them maintain independence in their own homes for much longer than would otherwise be possible.
So, how can childless people ensure they maintain independence and quality of life as they age?
The key is proactive health management and lifestyle choices that extend your healthy, independent years. Stay physically active, maintain social connections, keep learning and engaging your brain. Invest in preventative health care, regular screenings, dental care, vision and hearing care, mental health support. Catching and addressing issues early maintains independence longer. Learn to use technology that supports independence, medication reminders, fall detection, telehealth services, grocery and meal delivery apps. Technology can extend your ability to live independently.
What about maintaining purpose and meaning?
This is where childless seniors often have advantages. Without grandparent duties, you have more freedom to pursue passions, volunteer for causes you care about, travel, or even start new careers. Many of my most fulfilled elderly patients are childless individuals who've used their freedom to create meaningful, purpose-driven lives well into their 80s and 90s. Consider how you want to be remembered and what legacy you want to leave. This might be through mentorship, charitable giving, creative works, or community contributions.
Doctor, what's your final message for people worried about aging without children?
At 68 and childless by choice, I can tell you that aging without children isn't something to fear. It's an opportunity to create exactly the aging experience you want. The key is to start planning early. Be intentional about building support systems, and remember that quality of relationships matters more than biological relationships. I see many childless seniors who are aging better than their peers with children because they've taken control of their destiny rather than hoping family will handle everything.
Any final advice for people just starting this planning process?
Start now, regardless of your age. Begin building the financial resources, relationships, and support systems you'll need. Don't wait until you're 70 to think about these issues. Remember, having children doesn't guarantee good elder care, and not having children doesn't doom you to poor care. What matters is the planning, resources, and relationships you build throughout your life.
Doctor, thank you for this comprehensive guide to aging successfully without family caregivers. And to our listeners, whether you're childless by choice or circumstance, remember that you have the power to create an aging experience that's exactly what you want it to be. Start planning today for the independence and dignity you deserve. Anyway, if today's conversation gave you clarity or comfort, don't forget to follow or subscribe to the Senior Strength Show. We're here every day with real talk, expert advice, and thoughtful tools to help you age with confidence, on your terms. We'll see you next time on the Senior Strength Show, where we continue empowering people to age exactly as they choose.